Hi. Today I'm going to talk about understanding bone cancer. Bone tumors may be classified as primary tumors, which originate in bone or from bone-derived cells and tissues, and secondary tumors which originate in other sites and spread to the skeleton. Carcinomas of the prostate, breasts, lungs, thyroid, and kidneys are the carcinomas that most commonly metastasize to bone. Secondary malignant bone tumors are estimated to be 50 to 100 times as common as primary bone cancers. Primary bone tumors. Primary tumors of bone can be divided into benign tumors and cancers. Common benign bone tumors may be neoplastic, developmental, traumatic, infectious, or inflammatory in etiology. Some benign tumors are not true neoplasms, but rather represent hematomas, namely the osteochondroma. The most common locations for many primary tumors, both benign and malignant, include the distal femur and proximal tibia. Examples of benign bone tumors include osteoma, osteoid, osteoma, osteochondroma, osteoblastoma, enchondroma, giant cell tumor of bone, aneurysmal bone cyst, and fibrous dysplasia of bone. Malignant primary bone tumors include osteosarcoma, chondrosarcoma, Ewing's sarcoma, fibrosarcoma, and other types. While malignant fibrous histiocytoma, now generally called pleomorphic undifferentiated sarcoma, primary in bone, is known to occur occasionally, current paradigms tend to consider MFH a wastebasket diagnosis, and the current trend is toward using specialized studies to classify these undifferentiated tumors into other tumor classes. Multiple myeloma is a hematologic cancer, originating in the bone marrow, which also frequently presents as one or more bone lesions. Germ cell tumors, including teratoma, often present and originate in the midline of the sacrum, coccyx, or both. These sacrococcygeal teratomas are often relatively amenable to treatment. Stage 1A bone cancer, Stage 1B bone cancer, Stage 2A bone cancer, Stage 2B bone cancer, Stage 3 bone cancer, secondary bone tumors. Since, by definition, benign bone tumors do not metastasize, all secondary bone tumors are metastatic lesions which have spread from other organs, most commonly carcinomas of the breast, lung, and prostate. Reliable and valid statistics on the incidence, prevalence, and mortality of malignant bone tumors are difficult to come by, particularly in the oldest, because carcinomas that are widely metastatic to bone are rarely ever curable. Biopsies to determine the origin of the tumor in cases like this are rarely done. Symptoms. See also, cancer pain. The most common symptom of bone tumors is pain, which will gradually increase over time. A person may go weeks, months, and sometimes years before seeking help. The pain increases with the growth of the tumor. Additional symptoms may include fatigue, fever, weight loss, anemia, and/or unexplained bone fractures. Treatment of bone tumors is highly dependent on the type of tumor. Chemotherapy and radiotherapy. Chemotherapy and radiotherapy are effective in some tumors but less so in others. There are a variety of chemotherapy treatment protocols for bone tumors. The protocol with the best reported survival in children and adults is an intra-arterial protocol where tumor response is tracked by serial arteriogram. When tumor response has reached more than 90% necrosis, surgical intervention is planned. Medication. One of the major concerns is bone density and bone loss. Non-hormonal bisphosphonates increase bone strength and are available as once-a-week prescription pills. Metastron, also known as strontium-89 chloride, is an intravenous medication given to help with the pain and can be given in 3-month intervals. generic strontium chloride SR89 injection UPS, manufactured by Bionucleonics Incorporated. It's the generic version of Metastron. Treatment for some bone cancers may involve surgery, such as limb amputation, or limb-sparing surgery. Limb-sparing surgery, or limb salvage surgery, means the limb is spared from amputation. Instead of amputation, the affected bone is removed and is done in two ways: bone graft, in which a bone from elsewhere from the body is taken, or artificial bone is put in. In upper leg surgeries, limb salvage prostheses are available. The other surgery is called van-ness rotation or rotationplasty, which is a form of amputation, in which the patient's foot is turned upwards in a 180-degree turn and the upturned foot is used as a knee. Types of amputation: leg below knee, above knee, Sims hip disarticulation, hemipelvectomy or hindquarter, in which the whole leg is removed with one half of the pelvis. Arm below elbow, above elbow, shoulder disarticulation, forequarter. The most radical of amputations is hemicorporectomy, which removes the legs, the pelvis, urinary system, excretory system and the genital area. This operation is done in two stages. First stage is doing the colostomy and the urinary conduit. The second stage is the amputation. This is a mutilating operation and is only done as a last resort prognosis. The outlook depends on the type of tumor. The outcome is expected to be good for people with non-cancerous tumors, although some types of benign tumors may eventually become cancerous. With malignant bone tumors that have not spread, most patients achieve a cure, but the cure rate depends on the type of cancer, location, size, and other factors. Please click my link in description for more information. Thanks.